Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode, I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Hi, everyone, and welcome to rePROs Fight Back. I'm your host, Jenny Wetter. A quick bit of housekeeping before we start today's episode. Recently, I went to Vancouver to a conference on maternal and reproductive health called Women Deliver. And while I was there, I had the opportunity to record a series of 4 interviews. So over the summer, we're going to do something a little different. We're going to end up airing the show weekly. So I'm going to continue recording new episodes to keep us updated on the news and things that are currently happening on our normal every other week schedule. But on the off weeks when I don't normally have an episode, we're going to air some of this bonus content from Women Deliver. So keep an ear out for that. That'll be starting next week. And with that, I'm going to turn you to today's interview with Yamani Hernandez. Thank you. Hi, Yamani.
Hi. So glad to be here.
Thank you for being here. I'm really grateful. So there has been kind of a wild amount of restrictions happening in the States for a while, but particularly in the last couple weeks. Maybe we want to start talking a little bit about what we're seeing right now.
With abortion funds, we have known for a long time that Roe has never been a promise to abortion access, and so have been navigating barriers for a really long time. We're in a unique position with the president that we have and the Supreme Court that we have that has put more emphasis on a lot of lies and misinformation about abortion. And what we're seeing is the results of decades of anti-choice strategy coming to fruition, where we are seeing outright bans on abortion that are unconstitutional and at a pace that is hard to keep up with. And I think part of that is to tire us out and to also to really start to push towards constitutional change and trying to basically overturn Roe.
I think you made a really great point that I think often gets lost in the coverage. And so often the focus is on Roe being overturned, and that's going to be the final point of where people are going to lose access. But I mean, as you pointed out, Roe is not really the reality for a lot of people on the ground already.
Yeah, we like to say Roe is the floor, not the ceiling. It's the bare minimum of what we need. And so we, of course, don't want to see it overturned, but also the full promise of having legal abortion has not been realized with things like the Hyde Amendment, which prohibit public funding for abortion and make it impossible for many people to access care based on how much money they make or where they live and what insurance they have. And then other barriers that aren't addressed by things like the Hyde Amendment and the fact that 90% of counties don't have an abortion provider. And so for far too long, abortion patients have been traveling across state lines to get to care, even with Roe.
And it's great to see right now that Hyde is becoming a part of the larger conversation. It was great to see during a couple weeks ago where Biden said that he didn't support repealing Hyde, and it was quickly shut down that was the minimum that people are asking for from their presidential candidates.
Yes, we are so excited to see that. We saw that in the 2016 election, that Hyde for the first time became a part of the Democratic Party platform. And now, as we're headed towards this election, we can see that pretty much all of the Democratic candidates are it's a basic standard of understanding that abortion has to be legal and accessible for all. And we also know that we didn't get here by accident. So it's been actually the leadership of women of color, like the coalition All Above All, that have really been pushing over the last 5+ years to get this to be into the mainstream and the political lexicon of lawmakers and legislators. And, abortion funds were pioneers in that work as well. And for 20 years, pioneered on the Hyde Amendment as the main and only policy issue they worked on. So we're super excited to be helping power that campaign, All Above All campaign, and for the leadership of the folks who have made it possible to get to this moment.
Yeah, and I think also worth a shout out is this year, for the first time, the Each Woman Act, which would, among other things, repeal Hyde, was introduced in the Senate for the first time. So for all of the hard work, that's amazing.
Yeah, it's amazing, and All Above All has been instrumental in that at the federal level, and also a lot of state, some of the progressive state changes that we've seen as well have been a lot of work from All Above All campaign. And so we are super excited to see it's not a tit for tat, but for every really horrible thing that has happened in the last few weeks and months, we also have seen some really bright spots like Maine and Illinois. And so we're trying to hold on to what's possible at the state level and hoping that it, rolls up and becomes a tidal wave towards the federal level as well.
Yeah, when New York's change came, that just felt so needed because it just was kind of this unrelenting slog of terribleness for so long. So to see like a great new policy was a breath of fresh air.
Absolutely.
So unfortunately, to go back to some of the things we're seeing in the States, so, the anti-choice people are using really emotional, evocative language to try and push basically total bans on abortion.
Right.
To me, we want to talk about a little bit of what that would mean for some of the states that are already have a lot of restrictions in place.
Yeah, we hear from our members in the South in particular, but also in the Midwest. I think sometimes the Midwest gets left out of the conversation. But yeah, we hear from our members in the South. Welcome to the reality that we have been fighting for a long time. And also thank you for kind of waking up to what's been happening. So these bans on abortion, these are not the first times that they have been tried. Right. It's just they've been beaten before. And so, like you said, there's a cultural moment that's happening right now where the general public is being significantly manipulated or trying to be manipulated, because we know that 77% or whatever it is, 7 out of 10 Americans want there to be safe and legal abortion, even if they would never have one. But then you hear this rhetoric that is just outright lies, talking about nonsensical things like post-birth abortions and murder and all of these words that are really inflammatory and confuse the public about what abortion is. I think your average person doesn't always even know what an abortion is, or that it happens, that a lot of them happen before 10 weeks and with pills. And, so if you listen to this rhetoric, you can be really confused and also polarized, manipulated in a way that results in some of these fantastical things becoming a reality for some people. And I think it's heartening to see that, as swiftly as an abortion ban in Alabama might have come to pass, there's also been a swift backlash to that as well. And I've been really encouraged by the ways that people have really showed up and flooded in donations and requests to volunteer and ask for other ways that they can support on the ground, and to making sure that abortion stays legal, and that for the cases that where it may not, that people can still get to care by traveling. And then we also know that traveling will not be possible for every person. Right. And so that is why we have to, kind of always keep this two-pronged approach that abortion funds always do, which is, we try to take care of the people that we have now, while also trying to fight for the political and cultural change that we need, because we know that we can't take care of everybody at once.
I'm really glad that seems to be a little pause in all of the bans passing in the States, because for a while, with everything happening, I was doing rage donating and having to give to the abortion funds in Alabama and Georgia and Missouri. And which
New Orleans
was great,
yeah,
but I needed a cooling off month. And I think so, I think another thing that these bans are doing is they're getting so much publicity, which is good, but it's also scaring people away and thinking that abortion is not legal in their state and that they can't go get care. And I think that's also another important myth to talk about, is that right now abortion is still legal. You can still get care in all 50 states.
Yes. Yeah, I've heard a lot of abortion funds changing their outgoing messages to have that as a first line when you answer the phone is, abortion is legal in all 50 states, abortion is still legal, etc. Yeah, even before this, people have been confused because there's just a lot of misinformation online. In some states, there's 300 crisis pregnancy centers or fake clinics to one abortion provider. So in a state where you have 300 organizations and fake clinics trying to actively deceive people from being able to get the abortions that they want and need, it's it's been a struggle actually for people to understand that there's nothing wrong with an abortion, that it is legal, that it is your human right, not just your constitutional right, but a human right, for you to decide if, when, and how you make your family.
Absolutely. And beside the bans, there have been, real targeted efforts trying to close clinics with things that sound, I think, to a lot of people on their face, fairly innocuous, but are actually really designed to just close clinics, saying that an abortion provider needs admitting privileges at a local hospital. And I think when you talk to people who aren't like steeped in this stuff, it seems like, well, yeah, that seems perfectly logical, but but it's really detrimental and can force clinics to close.
Yeah, and that's why for us, political education is really important. People have asked, what our individual membership is and what we do with it. And for us, it's more than just an email list, but a place where we are doing, trying to do deeper education with individuals to help them understand this issue and the complexities about it. We've got a political education series that's going to be getting started that is tackling with our individual members and our fund members some of the nuances about abortion access that kind of get at some of those things that you think would be innocuous, but then when you really look at them, you're like, oh, this is completely racist, or there's some really problematic things about the way this is messaged, or and these are ways that I can adjust the way I think and talk about this issue. And we think that's really important because sometimes people just want to jump in and take action, quote unquote, and whether that's volunteering. And you saw this what was it called, the Auntie Network, where people were saying, I have a couch and come to me and I can support you. And it's, for us, we feel like it's really not that simple. Like, you need to have some baseline knowledge about the issue, about abortion, about the procedure, about the climate in which people are having abortions, and the things that they might be dealing with, the intersecting oppressions that they might be dealing with as they're navigating abortion care, in order to support someone going through it.
And I think that's leads to like the really important point, which is who's going to be the most impacted. I'm a white woman living in Washington, D.C. I'm going to be fine. But the people that are going to be impacted aren't the people who look like me.
I mean, most of the people that have abortions are people of color that are impacted by racism and economic injustices in this country, and that impact their decision making around whether they start to parent at all or whether they expand their families. So yeah, I mean, we have some data from the Tiller Fund that we have operated, and 50% of those callers are African American. And so we are pretty clear on, who our core constituencies are and who our work is for and about.
And it's just so important to make sure that everybody who wants to be able to access abortion care or decides they want to parent has the resources they need. And right now that just doesn't exist. So, you talked about the creation of the Auntie Network, and I think it brings us to the perfect point of saying a lot of that infrastructure already exists with abortion funds.
Yeah.
So you want to talk a little bit about what abortion funds are?
Sure. So abortion funds are grassroots organizations that are locally based and rooted, predominantly volunteer led, run, and powered, that basically help remove the financial and logistical barriers to abortion access, while also fighting against the political and cultural barriers that make their work necessary. So abortion funds help raise and pay for abortions. They help pay for and provide rides, childcare, and housing. Some of them have doulas, abortion doulas, or partnerships with abortion doulas, and are looking at emotional supports for people who are having abortions. So, and abortion funds have been around longer than the National Network of Abortion Funds, which is 26 years old, and 22 abortion funds started the National Network of Abortion Funds in 1993. And now we have 76 abortion funds residing in 41 states.
Wow, that's great.
Yeah. And so out of those 76, 29 have paid staff, and the rest are volunteer led and run. And the average budget size of a abortion fund, we just got our 2018 data back, is $175,000, so very small, with the average abortion funding budget of just under $40,000. So these are very small organizations, and we are really looking to build strong leaders and stable organizations with abortion funds. And that's where we come in as a national organization. We really support abortion funds on pretty much every aspect of their work, whether it's the technical aspects like operational things like helping with getting their boards together, or finance or legal supports, and other operational things, to leadership development, to network building, like convening abortion funds in regions and helping support them, organizing and advocating and coordinating their work across states, to movement building and grassroots fundraising, where we host the National Abortion Access Bulletin, which is where abortion funds raise about half of their annual budgets.
And they're a lot of fun.
Yeah, it's also a lot of fun. And we believe that abortion access does not have to be something that is not fun. Abortion, the bulletin, and all of our events are really aimed at being funky and fun and irreverent, and instilling hope and joy. And we really believe that our joy and our hope are part of ways that we resist. Miriam Kaba, a prison abolitionist and expert on transforming harm, told us at our last summit, this quote from Audre Lorde, that despair is the tool of our enemies. If it's up to them, we will be sad and sullen and dehydrated and completely not taking care of ourselves, until we wither away. And we aren't willing to do that. And so we find ways that we build our technical strength, but that we also build community and alignment in our values and our wisdom, and the ways that we take care of each other.
Yeah, I also really like, I support my local abortion fund, but I also like through the National Network's website, when you give a donation, you can select the abortion fund you want it to go to. So I was able to tie my monthly donations to one of the abortion funds back home, which is Wisconsin. So it's nice to be able to, for people, you can go out and support your local one, or you can find a state where you think might need help and go out and support them as well.
Yeah, we really try to not make it an either or thing, but operate from a place of abundance, and encourage people to do both. I mean, they do different things, right? Like if people want to directly fund abortion, then we always direct people straight to their local abortion funds. And we recognize the power that we have as a national organization, but are also trying to really dismantle what it means to be a national organization, because we really are rooted in the local power of our members. And our board is predominantly member based. Our staff is a third directly from our membership. our staff is 75% people of color. It's gender expansive, it's multi-religious. We're really trying to make sure that we are doing this work in a way that represents people most impacted, and that it's not, a bunch of elderly white women that are sitting in a room deciding what's going to happen at the national level for communities of color in the South and the Midwest and all over the country.
That's really important, and it's so important to reflect your values. Let's see. Anything else you want to talk about abortion funds?
I am in love with this network. Every day I'm inspired by the work that they do. And, I really try to, sometimes there's a narrative around like, a single charismatic leader. And I feel like our network is really leaderful. And we are like, we cross-pollinate with each other and learn a lot from each other, both, nationally, locally. If anything, I want to just lift up that piece about being a network, and the fact that even though we're a national organization and we can't really get around that, we are always really trying to dismantle what that means and how we can share power with our members and what that means for operations and the ways that we do our work. So
I think that one of the things that I got really excited about in the bleakness of the wave of abortion bans recently was one of the first responses I saw to the Alabama one was funding an abortion fund, which I think was one of the first times I saw that as the immediate response, which was wonderful.
Yeah, it was definitely, it was a shift in the tide. And I think, Hillary Clinton directed people to donate to abortion funds. Both Kamala Harris and Bernie Sanders sent out appeals on behalf of abortion funds. And it was really exciting to see, and is exciting to see a national conversation happening about abortion funds. And several of our members have been invited to tables that they haven't been invited to before, and I'm thrilled about that, because we have long said that it's the people on the ground that are the best architects of solutions, and the people who are most impacted by this that are the best decision makers around what needs to happen next. I think we have been doing things a certain way for a long time and have had a lot of missing voices. And so I'm thrilled to, see our members being lifted up and gone to as experts on this issue.
Is one of the things that we saw a lot of bigger name people doing in response is saying that we need to boycott Alabama or Georgia. Do you maybe want to tackle why that's maybe not the best idea?
In terms of people advocating for boycotting Alabama and Georgia, it discounts how the people most impacted in Alabama and Georgia are impacted by a boycott like that. If you're trying to punish the legislators who have made poor decision making, challenge them in a political way. But taking away job opportunities for local people who already are struggling to get by is not helping the people that you're trying to help. It's a PR stunt that gets a lot of traction in the news, but I think it's always important to kind of go back to the states and ask what they need. And all I've heard from Alabama and Georgia is please don't boycott. Don't, like, the people that we work with say that is not helpful. So trust the people who are most impacted, and that is the best decision making.
Thank you. I wanted to make sure to lift that up because that's the same thing I've been hearing as well. Okay, so I always like to end the podcast with an action. So what can listeners do to support abortion access?
Sometimes people think it sounds frivolous to ask people to donate, but in our cases, abortion funds are only able to support almost a fifth of the people that, a little over a fifth of the people who call for help. So donations actually make a huge donations make a huge difference if people want to make sure that direct access to care is made possible. Paying for an abortion, paying for the associated costs of getting an abortion, we say is a revolutionary and political act, especially when the government refuses to. So we always encourage people to donate. You can donate to your local fund or donate at the national level, and we are building a large fund that regrants to the local fund. Then again, we could become a member of abortion funds and anchor to your local fund. Abortionfunds.org/member is the way to do that. It's on a sliding scale from $0 to $25. You get a cool t-shirt that says everyone loves someone who's had an abortion, and other merch with that same message.
Yeah,
over
there's
the
some
years.
pretty great swag to check out on the site that you should all
Yeah,
get.
you can bust abortion stigma by talking about abortion, participate in our campaigns like the Heart to Heart campaign, which is a cultural change campaign where you basically talk to people in your lives about abortion. If we can't talk to our family members about abortion, it's a little bit harder to make this mass change that we're trying to make. So say abortion, say the word, talk about abortion funds, get connected to your abortion funds, donate to your abortion funds, and stay involved politically as well. Let your local and national lawmakers know where you stand on this issue, and those are all ways to support us in this work.
Wonderful. Well, Yamani, thank you so much for doing this.
Thank you for having me.
For more information, including show notes from this episode and previous episodes, please visit our website at rePROsFightBack.com. You can also find us on Facebook and Twitter at rePROsFightBack. If you like our show, please help others find it by sharing it with your friends and subscribing, rating, and reviewing us on iTunes. Thanks for listening.